What primary care providers say to a person with an eating disorder can have a lasting impact. Many clinicians miss the opportunity to learn more about a patient's eating or exercising habits by shrugging off comments that would be normal in a healthy individual. They may also say things with good intentions that push the patient further into their disorder. This is Bianca. She's been suffering from an eating disorder for 11 months. It started shortly after her last yearly checkup. She was at a higher weight back then and has since dropped a bit of weight. She's about to have her yearly exam with her nurse practitioner, Steve Simmons. What he says in these moments can lead to a road to recovery or unwittingly push her farther down the dark, damaging path she's already on. It all comes down to how he asks the important questions.
So, how are you today?
I'm fine.
What a great improvement in your weight. You must be taking good care of yourself.
Steve is placing positive emphasis on her weight loss, reinforcing that weight is more important than health. Little does he know Bianca has been obsessively counting calories and skipping meals with her family. His feedback reinforced for her that what she's doing is good for her. This could lead to further weight loss and malnutrition. Let's give him another chance at that question.
So, how are you doing today?
I'm fine.
So your weight is down from last year. How are you taking care of yourself?
Now Steve is playing it neutral, just the facts, and a gentle inquiry about her habits. With this approach, he enables her to open up.
I got into a good routine at the gym. I run the treadmill for at least an hour every day.
Great. Cardio is a good choice. Keep up the good work.
Generally speaking, going to the gym regularly isn't a red flag, but this is not necessarily the case when an adolescent is losing weight. What he doesn't know is that Bianca goes to the gym twice a day if she feels she's eaten too much. Let's give him a chance to ask a question.
How about your eating? What types of foods are you eating to sustain that sort of routine?
I don't eat a lot of carbs since they're empty calories, and there's not a lot to eat at school. The cafeteria only serves junk, and I'm trying to eat healthy foods.
Steve now has enough information to know that Bianca may be experiencing an eating disorder, and he has specific information with which to inform his next steps in her treatment. This is Peter. He's been suffering from an eating disorder for 2 years. It started gradually, but his doctor, Carol Rodriguez, noticed he dropped in weight, which she knows shouldn't happen during adolescence. Peter reports being very tired and exhibits a lot of bruising on his arms and legs. Carol has asked him about his eating habits.
All right, Peter. So, how have you been eating?
I grab a banana on my way to the bus, and coach said if I stay in my weight class, I have a shot at the championship title. I usually skip lunch and spend a few hours at the gym.
Carol has now been given specific information regarding a restrictive diet and has a choice on how to respond.
Okay, I see the problem here. You just need to eat more.
Carol has fallen into one of the most common mistakes. Telling a patient with an eating disorder to just eat more is like telling someone with cancer to just get better. While the symptoms are behavioral, we have to understand that it's not always within their control. Let's try again.
Didn't the wrestling season just end? What are you normally doing for dinner? Are you sitting down and eating with your family?
My mom usually just lets me grab a granola bar and eat in my room.
Carol is concerned that Peter's limited intake will lead to adverse health effects. To address the problem, she can speak to his parents and even suggest a family meal as a starting point. One of the most important things she can do is to schedule a follow-up. If she waits for a year to pass in between annual checkups, Peter's behavior could have enormously damaging effects. Jane has always been a little overweight. Nurse practitioner Steve Simmons has supported her over the years in her efforts to diet and given her nutritional advice. Her lab showed an elevation in cholesterol since last year, but he attributes it to her age.
Thanks for coming in. So I see it was your birthday yesterday. What did you do to celebrate?
My office had cake yesterday to celebrate, and I took the cake home even though I was nervous about losing control and eating too much. After dinner, I went to have one slice and ended up eating the whole thing. I felt so sick afterward.
Cake is my wife's weakness too, but it's never a good idea to overdo it. Make sure to keep exercise a part of your routine.
While it's easy to diffuse the situation by relating to personal experiences, the patient has just said something that was probably very difficult for her to bring up. Telling her to stop something she may not be able to control isn't helpful.
After dinner, I went to have one slice and ended up eating the whole thing. I felt so sick afterward.
How often do you find yourself eating until you feel sick?
A follow-up question like this avoids shaming the patient and allows him to gather more information. While a primary care practitioner can offer support, this may be a good time to refer to a therapist or eating disorder specialist. Nina is here for her yearly checkup. She's lost a bit of weight since last year. She's thin, but she's still within the normal weight range for her height and age. She's reported some depression and anxiety, but otherwise appears healthy.
Okay, Nina, you sound good. So, anything concerning you?
My friends keep telling me I'm too skinny and that I need to eat better, but I keep telling them I'm fine.
What Nina isn't sharing is that she barely eats, and her friends are noticing.
Well, your BMI is normal. You're not too thin, so I'm not really worried about it.
This can be a very triggering comment. A person with a restrictive eating disorder may carry this statement in her mind for years to come. If she's not too thin, she may hear that as clearance that it's okay to lose more weight. Furthermore, BMI is not always a good measure of health. It doesn't take into account individual differences, habits, or growth trajectory. This is a good opportunity for the doctor to try and change an unhealthy behavior.
Well, I didn't expect to see a drop in your weight, so let's talk about what you're doing differently and what a healthy diet looks like, okay?
Okay.
Sammy has fluctuated in her weight a lot, but has always been within a normal BMI range, while her nurse practitioner Steve Simmons has kept track of it. Until today, he assumed it has been related to stress and the patient's reported anxiety. He noticed some damage to the enamel on her teeth, and she admitted to vomiting after eating.
So I noticed some damage to your enamel on your teeth. So what's going on?
Sometimes when I feel I've eaten too much, I make myself throw up.
This isn't healthy for you. You're doing damage to your body. It's a good thing your weight is staying in the normal range.
An individual with bulimia nervosa will often present with normal weight, and his statement has minimized the problem, leading her to think it's not as severe as it is.
I'm really worried about you. Let me see how I can help. Have you ever considered seeing a therapist or going to support groups?
Helping a patient acknowledge their problem is a key step in their recovery process. Most patients won't offer information too easily, so asking open-ended questions, sharing other patients' similar experiences, and pointing out the severity of their illness may be the thing that motivates them toward treatment. While it may sometimes feel like navigating a minefield when dealing with eating disorders, it's important to remember that what you say matters to the patient more than they let on. Keep these 3 points in mind. 1. Don't make judgments about a person's weight, even if they are positive. You may be reinforcing some unhealthy behavior. Instead, always lead with a question and gather information about their changing lifestyle. 2. Don't overlook or minimize an eating disorder by confusing it with a diet. Many people diet, but a person with an eating disorder may have a pattern of pervasive and obsessive behavior, accompanied by distorted body image. 3. Don't tell someone to just stop their unhealthy behavior or just eat more. Remember that eating disorders are a combination of psychological and physical symptoms. While entrenched in their illness, individuals may feel ambivalent about recovery and feel unable to change their behavior. Instead, ask them about their habits, provide them with accurate information about nutrition and exercise, and encourage them to seek further help.